and welcome to our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are producing a brand new lecture pack titled Safe Travels Best Practice for Neonatal Transport. And here with me is one of our speakers of the lecture pack, Dr. Nandiran Ratnavel. Welcome, Dr. Ratnavel.
Thank you very much indeed, Kristen.
It's wonderful to have you here. I'm so glad we're producing this brand new package because neonatal transfer is such an important topic. But before we go into your presentation, tell us a little bit about yourself. Where in the world are you today, Dr. Ratnaval?
Well, I work in London and I work in a surgical NICU setting, but the hospital I work in also hosts the regional neonatal transfer service. So I lead that service. I've been in post now for 16 years. And it's been an exciting time because since I started my post, the growth of transport medicine has really come
Mhm.
a long way. And I think with reorganization of neonatal service into networks, the importance of safe transfer between units has become more and more important. So it's a real pleasure and privilege to lead the service. And thank you for inviting me today.
Yeah, it sounds like you're right. It sounds like it is an exciting time because when you said you've been there for 16 years, a lot has happened. You know,
Mm,
technology has changed. Of course, now everything is digital. We have all kinds of different possibilities now to communicate, to organize, and so on. We have apps now on the phone.
mm.
That was
Yeah.
not possible 16 years ago, right?
That's right. That's right. And I think the principles of neonatal transport, whether it's low technology or high technology, I think there are some basic principles that still
Yeah.
apply in whatever setting. And I hope that I can impart some useful information, whether it's irrespective of the level of technology. So I hope there'd be some fruit there for an international audience.
Absolutely. I have to ask you this question. We are still, of course, in COVID times
Mm,
here. It's 2021. We are in May here. Tell us a little bit how has this affected your unit? What have you seen? Just give us a little overview of what's happening
mm.
and the future. Where are we going from here?
Yeah, absolutely. Well, I think as far as neonatal practice, some strange things happened. I mean, I think at a time where we thought everything was going to become unmanageable in terms of
Mm,
neonatology, certainly in my experience and in my region, neonatal intensive care actually became somewhat quieter, bizarrely. And we couldn't really explain that, and I think we still can't, because neonatal practice is not really subject to seasonal variation. It's not really, it doesn't really generally affected by sort of infection outbreaks in predominantly adult populations. But I think where it did impact actually was in terms of maternal care. I think there was a lot of fear actually of coming into
mhm.
hospital to deliver babies, and perhaps in some respects maybe that was why neonatology was also by consequence a little bit quieter. But I think where we really felt it was adult intensive care, and although
Mm,
that's not my area of expertise, at the time, at the peak of the pandemic, our adult intensive care had to expand to 4 times its usual footprint.
mm.
So it was all hands on deck, really. So specialists in adult intensive care, as well as non-specialists from every different discipline, all
Yeah.
went to assist in the adult intensive care setting, and that included myself. So it was very busy indeed from that point of view. And
Mhm.
at the same time, we had to keep our neonatal services ticking over as well. So it was quite stressful from that
Yeah.
point of view. Our neonatal work was largely unchanged, but our desire to and our need to support our adult intensivist colleagues really made things quite tricky.
Mhm. Absolutely. I can imagine that put a huge strain on the personnel, the staff, and everybody involved, in this situation. It must have been
Sure.
quite difficult and stressful there as well.
Mm,
You brought up an important point there. You are right. There has been a big trend with regards to birthing. From away from the hospital, and
mm,
more people during COVID have inquired about giving birth outside the hospital in either home birth setting or
mm,
birth center setting. I'm operating here in the United States. We've seen the trend here. My colleagues and friends in the field have reported a huge increase in inquiries for home birth and practice, birth as well. So there, it might be a difference there, as you mentioned there as well.
mm,
With regards to transfer, we, as I can report here, working in the out of hospital scenario, we do have our drills that we run if we need to transfer to the hospital, not
mm.
necessarily to the neonatology unit, to the NICU and ICU, but we have our drills in place. What do you have in place for, do you have something similar there in your area where you work? Are you working with out of hospital professionals as well, or how does that work?
Sure. Well, actually, fundamentally, as a transfer service, we run an interfacility transfer service. So
Hmm.
it's really hospital to hospital
Right.
rather than home to hospital. But that said, because we're a long-standing service and we work very, very closely with the regional ambulance service, so they are
Hmm.
very much part of our clinical team, and because of that, we've developed very helpful links with our ambulance provider. And so we do pre-hospital training for them, and their personnel come to join our neonatal transfer service as part of yearly secondment.
Mm.
And during that time, they are really able to upskill in newborn resuscitation, managing, recognizing the well baby, the ill baby, doing lots of routine postnatal checks, attending deliveries. So those ambulance personnel who work with our team then go back out into the community and with a different
Right.
level of skill when it comes to attending unplanned home births, for example, or home births that have become more complex. So
Hmm.
although we are an interfacility transfer service and not really involved in pre-hospital, our teaching and training and connections have given us avenues into that field that I think has been a win-win on both sides.
Wonderful. Yeah, it sounds like really a win-win for everybody. Yeah, as well. So let's talk about your presentation. Your
Mm.
presentation is titled Risk Management and Neonatal Transport. And you mentioned also this is not only for the high resource setting but also for anybody, regardless where in the world you practice or work, correct?
That's correct. Yes, I mean I do work in a high resource setting, and I'm aware of that. But I have done some work in the developing world as well with setting up of basic interfacility neonatal transport provision, and I think there are lots of fundamental principles that can be applied across different care settings.
Give us a little overview of the presentation without giving too much away, just a
Sure. Yeah. Yeah.
sneak you what can we
Absolutely.
expect.
Yeah. Well, the reason why I've ended up, I think, giving this talk is because it's something close to my heart. And I think when I
Hmm.
started in this business, um, th- th- I think neonatal transport as a branch of transport medicine or even a branch of neonatology was probably under recognized. I think it's fair to say. And I think it was regarded really as an extension of neonatal intensive care practice. But I think what was we very quickly realized is that the transport environment was quite different from a NICU
Mm.
environment, and the impact of that on the infant undergoing transfer, as well as the staff who are not necessarily trained to be working in a moving setting.
Yeah.
Um, as in the ambulance or the aircraft, but also not necessarily used to being primarily responsible for equipment troubleshooting, for liaising and working closely with professionals that they did not know, that they
Hmm.
did not work with on a day-to-day basis, and all of the team working and communication challenges that brings when one is working with an unfamiliar team. I think that was under recognized. I think the impact on the staff and the patients was very tangible. And what we've been able to show over the years is the rates of adverse incidents, the rates of adverse events have dramatically come down as a consequence of recognizing that neonatal transport as a standalone entity required its own equipment, its own training packages, its own team working ethos.
Hmm.
And so we've come a long way as a consequence of that, really. I think there were certain mechanics around transport, the need to move a patient from A to B to receive
Right.
a level of care or intervention that was unavailable at the local hospital has always been there. But in terms of minimizing the accidents, adverse events, miscommunications, equipment failures that were really
Mm.
quite common with untrained teams, we're now seeing the importance of using trained teams. And so my talk really is about the value of that, about the concept of identifying risk, mitigating risk, and constant learning and training to make it a safer team, ultimately for the benefit of the baby, secondarily for the benefit of the staff.
Mm. Thank you so much, Dr. Ratnavel. This sounds absolutely fantastic. The information is very well needed here, and I'm so glad you're presenting this as part of the lecture pack. And thank you for sitting down here with me and talking about your work and the presentation.
My pleasure.
And for our viewers now, this presentation is part of Safe Travel's Best Practice for Neonatal Transport. The package is available June 1st. And if you would like to learn more about it, please visit goldneonatal.com and goldlearning.com. Thank you, everyone, for viewing. Bye bye, everyone.